Amiodarone tablets is used to treat certain types of serious, possibly fatal, irregular heartbeat, such as recurrent ventricular fibrillation, tachycardia. It is used to restore normal heart rhythm and maintain a regular, steady heartbeat. Amiodarone is known as an antiarrhythmic drug. It works by blocking certain electrical signals in the heart that can cause an irregular heartbeat. Indications: Amiodarone affects the rhythm of your heartbeat. It is used to help keep the heart beating normally in people with life-threatening heart rhythm disorders of the ventricles, the lower chambers of the heart that allow blood to flow out of the heart. Amiodarone is used to treat ventricular tachycardia or ventricular fibrillation. Amiodarone is for use only in treating life-threatening heart rhythm disorders. How to use: inside, during, or after a meal. The tablet is taken well with a small amount of liquid. The dose of the drug should be adjusted depending on the patient's condition and determined by the doctor. The initial dose is 600 to 800 mg up to 1200 mg per day, divided into 2 to 3 doses. The course of treatment is 8 to 15 days. If necessary, it is possible to increase the dose to 1200 mg of amiodarone per day. After reaching signs of saturation, they proceed to maintenance therapy. With maintenance treatment, the lowest effective dose is used depending on the individual response of the patient and usually ranges from 100 to 400 mg per day in 2 to 2 doses. In cases where this is possible, every 5 days of taking the drug, take a 2-day break. For adults, the average therapeutic single dose is 0.2 grams, the average therapeutic daily dose is 0.4 grams, the maximum single dose is 0.2 grams, the maximum daily dose is 1.2 grams. Contraindications: sinus bradycardia, syndrome of a weak sinus node, sinatral or AV blockage of the second and third degree, without the use of a pacemaker, cardiogenic shock, collapse, hypokalemia, arterial hypertension, hypothyroidism, insufficient secretion of thyroid hormones, thyrotoxicosis, interstitial lung disease, reception of monoamine oxidase inhibitors, the period of pregnancy and lactation, hypersensitivity to the components of amiodarone or to iodine. Warnings: if you're driving or has this activity, until now how amiodarone will affect you, your actions could be impaired. Grapefruit may interact with amiodarone and lead to unwanted side effects, avoid the use of grapefruit products. If you're taking a herbal supplement containing St. John's wort, many drugs can interact with amiodarone. This includes prescription and over-the-counter medicines, vitamins, and herbal supplements. Tell your doctor about all your current medicines and any medicine you start or stop using. Amiodarone side effects: get emergency medical help if you have signs of an allergic reaction to amiodarone, hives, difficulty breathing, swelling of face, lips, tongue, or throat. Amiodarone takes a long time to completely clear from your body. You may continue to have side effects from this medicine after you stop using it. Call a doctor at once if you have any of these side effects, even if they occur up to several months after you stop using this medicine. Wheezing, cough, chest pain, cough with bloody mucus, fever. A new or worsening irregular heartbeat pattern, fast, slow, or pounding heartbeats. A lightheaded feeling like you might pass out. Blurred vision, seeing colors around lights. Your eyes may be more sensitive to light. Liver problems, nausea, vomiting, stomach pain, upper right side, tiredness, dark urine, jaundice, yellowing of the skin or eyes. Nerve problems, loss of coordination, muscle weakness, uncontrolled muscle movements, or a prickly feeling in your hands or lower legs. Signs of overactive thyroid, weight loss, thinning hair, feeling hot, increased sweating, tremors, feeling nervous or irritable, irregular menstrual periods, swelling in your neck, goiter. Or signs of underactive thyroid, weight gain, tiredness, depression, trouble concentration, feeling cold. Common amiodarone side effects may include nausea, vomiting, loss of appetite, or constipation.